Better walk ahead.
Welcome, everyone. Thank you for attending today's White Coat ceremony. You may be seated. I'm Dr. Matthew Richardson, Director of Clinical Radiology at Palmer College of Chiropractic's Florida campus. We are here today to mark a significant milestone in the educational journey for our students. The white coat is the iconic symbol of physicians for over a century. Today's ceremony signifies a rite of passage reflective of our students' transition from an academic classroom to a clinical setting and marks the beginning of their patient care career. Today's ceremony is representative of each student accepting their responsibility to be prepared, professional, respectful, ethical, and compassionate with all patients. I would like now to introduce today's guest speaker, Dr. Sean Norkus.
Thanks, Dr. Richardson. Thanks, class 233. Colleagues and the friends and family of students that we are here to honor, welcome to the White Coat ceremony. I'm incredibly appreciative of your invitation to speak, and will do my best to keep this, like Dr. Robatsky, short and sweet. For those in the audience, know that you guys are here to witness one of the largest professional milestones in the lives of the students of this class. While not graduation, this event is a significant transition that marks the students moving from their preclinical education to the clinical application of their academic knowledge. Chiropractic, like another number of other professions, mark this transition with a white coat ceremony that demonstrates competency and successful completion of the academic requirements and the beginnings of their clinical curriculum. As you guys begin your time in clinic, you have a lot to think about. Please start by realizing that your education is far from complete. Recruiting patients, learning the clinic ropes, maintaining grades, and studying for yet another board, just to name a few. While these are all incredibly important, please realize you are now in the infancy of your careers. Treat every day in the clinic practicing the skills you want to utilize in your practice and be known for. A few examples. Dr. Kingsley became an expert in Grostic Are you an expert in Grostic technique, Dr. Kingsley? No, okay. Dr. Kingsley became an expert in neurology through practice. Dr. Papagallo became an expert in lumbopelvic technique through practice. And I became an expert in various food and beverage through local restaurants. All joking aside, strive to learn something new every day, you guys. While you might already have an idea of how you want to practice, the mentorship of your clinician might open a door that you never knew was there. Just like developing your chiropractic technique in classes and adjusting labs, the clinic mentorship process allows you the opportunity to practice and develop your professional demeanor and approach to patients and their care. Because you're sitting here, you've already demonstrated the academic competency to work on patients. First, students, and then outpatients. As I've mentioned, each and every one of you will continue to add to your academic knowledge, but don't forget your need to connect with patients on a personal level. Remember, most patients don't enjoy the process of going to a doctor regardless of their specialty. The humorous Dave Barry says, "I become faint and nauseous during even very minor medical procedures, such as making an appointment by phone." Develop relationships with your patients to help them see your appointments in a more positive light. In order to get you thinking about how to connect with your patients, I've randomly selected 3 positive reviews of local chiropractors to get you thinking about what patients truly appreciate during their time with you. Here's the first. Great comfy waiting area, even though there's not much of a wait. Good music playing, super friendly staff, always willing to assist. The doctor, which is in quotes for some reason, explain thoroughly every step and findings and also treatment options. His energy and passion for helping others is something you feel as soon as you walk in. Second one, I've never met a doctor so attentive to my needs, and I've been sending my whole family to see him. The third one is short and sweet. He spends time with you. The fourth, best chiropractor in town, his staff is the friendliest, and this doctor's office makes you feel like you're a part of their family. Highly recommend to anyone in need of a 5-star chiropractor. If you notice, none of these reviews mentions the doctor's GPA, the student clubs they ran, or their years of practice. They also don't mention technique. Not that these aren't important for a variety of other reasons, but as any good performer will tell you, you have to know your audience. In fact, many of the reviews you find online spend more time reviewing the staff and environment instead of discussing the physician's skill set. My favorite of these, of the ones that I've shared, is simply, he spends time with you. Make personal connections to ensure your success. Learn from the skill sets of others and begin to practice like those around you that are already successful. Honor the decision that you have made and the decision of the patients to see you, and do whatever it is within your power to ensure they have the best experience ever. And remember, as chiropractic interns, you are now representing both yourselves and an entire profession. Go above and beyond with each appointment. None of you in this room would actively choose to see a doctor who was just scraping by with the minimum, so please don't expect those under your care to feel any differently. As you prepare to start your time in clinic, please remember the basics you have been taught while not being afraid to think outside the box. To continue to improve these connections, think of 2 quotes from the neuroscientist V.S. Ramachandran. I promise I'm almost done. You guys are all checking your watches. But yeah. Thank you, sir. Those were the 2 quotes. It was awkward, very poignant. One of the first things we teach students is to listen to the patient by taking a careful medical history. 90% of the time, you can arrive at an uncannily accurate diagnosis by paying close attention, using physical examination and sophisticated lab tests to confirm your hunch. Always rely on the history and examination that you have learned as a reliable first step in the diagnosis of your patients, but realize that as doctors, your skills and approaches will continue to evolve. Here's Ramachandran again, referencing his time in practice. I learned an important lesson. Never take the obvious for granted. Once upon a time, it was so obvious that a 4-pound rock would plummet earthward twice as fast as a 2-pound rock that no one ever bothered to test it. That is until Galileo came along and took 10 minutes to perform an elegantly simple experiment that yielded a counterintuitive result and changed the course of history. Do not be afraid to constantly evaluate your professional views, values, and opinions. This process will ensure that you stay fresh, at the forefront of the profession, and passionate about seeing each and every patient that walks through your doors. Thank you guys again for the opportunity to speak. You all know how much each and every one of you mean to me, and it's been an honor to be a part of this day. Good luck during your time in clinic, and don't forget we're here on the academic side if you need a pep talk or 2 along the way. Congrats, guys.
Class 233, please present yourselves. Shelby Anderson. Alexandra Antoine. Neil Barron. Sarah Beard. Nicole Beck. Chase Billiot.
Let's go! Yeah!
Matthew Booth. Granger Brown. Vincent Caballero. Chong Quaitong. Haley Cole. Ethan Cormany. Michael Cox. Daria Dalia. Austin Ellsworth. Christopher Erico. James Goldberg. Kevin Gomez Diaz. Rachel Harnish. Colleen Hart. Thomas Jensen. Megan Jeffrey. Tyler Johnson. Cameron Kelly. Whitney Kelly. Kyle Lashley. Brooke Blonick.
Brooke!
Andrea Morrow. Amy Newton.
Amy!
Leo Nunez. Jenna Orstein. Nicholas Ortman. Shannon Palmer. Nikita Patel. Vanil Perez. Joseph Polchinski. Caitlin Prakash. Jack Ryder. Jonathan Reyes Cartagena. Ian Rivera. Eduardo Rodriguez. Alana Sanchez.
Te amo, mi amor.
Bella Margarita Serrano. Tara Snyder. Clayton Sparks. Brendan Steiner. Noah Steinhauer. Alexander Storino. Macy Storino. Alexa Thompson. Brandon Tornavaca. Chloe Whalen. Whitehurst.
Better walk.
Yes, ma'am.
This concludes today's white coat ceremony. We would like to thank everyone for joining us today. Class 233, welcome to clinic.